This is Sheila, if you don't know. And I started the prolotherapy, PRP, and regenerative medicine groups. But I get all of these kind of common questions, and in the end we're going to get to kind of the idea of what comprehensive treatment means, how to do diagnostics. There's always going to be exceptions to the rule. I want everyone to understand that. I want people to have just kind of a simple resource to help them understand how this works and how to start and approach it. And I know a lot of people can't read hundreds of resources to get started. I'm hoping that this will be a simple guide to help you get started. So I think maybe the first place to start is, why might someone get regenerative medicine to begin with versus conventional medicine? Well, I think unfortunately the way that it works right now is that it goes backwards, and that people usually do it as a last resort rather than early on. But I think that the two main reasons that people get it are for pain that has become unmanageable or injury. And often those two things go hand in hand. Very rarely, sometimes, but very rarely do we have pain without injury. Rarely, unfortunately, do we have injury without pain. Or actually, maybe fortunately, very rarely do we have injury without pain. And they kind of go hand in hand. And that's kind of the point that I want to make, is that if you're having a lot of pain, there's very likely some kind of injury that is going along with it. And just because the doctors can't find the injury doesn't mean that it doesn't exist, because the state of our diagnostics right now, especially with regard to soft tissue injuries, are very, very poor. So just because your doctor hasn't found your injury, it doesn't mean that you don't have one. It just means that they haven't done probably the proper diagnostic testing to find your injury. You know, there are other types of pain sometimes. There are different types of neuropathies that can occur where they truly can't find, you know, even the best doctors in the world can't find an identifiable injury. And we don't have to get into a debate about that. It does exist. There are pains that sometimes there isn't an injury right there where the pain is. But very often there is an injury. And just because they haven't found it, it doesn't mean there's not one. So I just think that's an important concept to keep in your head as you go about your regenerative medicine process. And think about when you have pain, you know, how do I want to go about reducing this pain? Do I just want to get rid of the pain? Or do I actually want to seek out a restorative process to reduce that pain? So then, if we approach it from that perspective, and we think about injury, then we need to think about what are the most common types of injuries we can have. Now, there are a multitude of injuries. I'm not going to get into all of them. I mean, the first one I want to get out of the way is bone injury. Particularly prolotherapy is contraindicated for bone injury. So if you have osteoporosis, you have osteogenesis imperfecta, or you have a fracture, do not get prolotherapy under any circumstances, because the procedure itself can cause a fracture if you have weak bones, or if you have an active fracture it can. Now, keep in mind that fractures do heal very, very quickly. So if you broke your leg like a year ago and you're like, oh my god, I can't get prolotherapy. No, that's not how it works. They heal up in about 6 weeks, 8 weeks for sure, you're fine. So don't panic if you've ever fractured a bone in your body. That's not a big deal. But if you have a bone condition, be careful about it. Platelet-rich plasma, they're kind of debating about it. Stem cell, they actually do have stem cell procedures for it. They're in a very experimental, rudimentary phase. If you have a disorder like this, I mean, it can be a very devastating disorder for some people, especially once they get into the large bone fracture stages of the disorder. I'm not saying to ignore it. I'm saying look to stem cell and look to those experimental things, because really that's probably your best bet. But don't go in for prolotherapy. You may end up being one of those bad statistics that we hear about, and that's not what we want in this group. There's neuropathy that can occur. Actual nerve damage can just happen, and there's lots of that. So that's, you know, on the other end of the spectrum, which there is neural prolotherapy that can help with that. But if you're gonna get your nerves treated, again, kind of what I was saying before, make sure that you don't have another injury going on with that. Because what will happen to you is that if you get your nerves treated, this goes along similarly to if you get a nerve block done. A nerve block, or sometimes people even have their nerves severed to end their pain. You know, it's similar to the philosophy of people who have diabetes and their nerves stop working. People have had such severe problems with their nerves discontinuing to function properly that they stop feeling pain. Or people even have disorders where they don't feel pain. Their bones can just crumble underneath them. There's a function to our nerves. There's a reason why our nerves send pain signals to us. And you want to make sure that you're not ignoring a really significant injury in your body. If you have true neuropathy, if you have true nerve damage that's causing pain to your body, that's fine. And it's a great treatment if you have that. But before you jump to that, get the full assessment. Make sure that you don't have an injury in your body. Because if you do, you can end up with really serious injuries. The NeuroPro, it's a little safer. What it does is it resets your nerve channels for a short amount of time. But if you do have a true injury, that pain will just come right back. So what you mostly will have done is wasted your money. However, there will be a short amount of time while your nerves are resetting that you could be doing active damage to those injuries that you have. So just try to really get a full assessment and make sure that you're not doing that and not wasting your time. Important thing to note is that if you have neuropathy plus an injury, you can get both. You can get regular prolotherapy, regenerative medicine, all that stuff, and you can get NeuroPro also and get the neuropathy reset and decrease your pain at the same time or shortly after. A big thing, the reason why a lot of people have pain, is due to soft tissue injuries. Some soft tissue injuries, doctors can be great about diagnosing, and others are not. I would say most soft tissue injuries, they're not good about diagnosing. Great about diagnosing broken bones, and then after that, it goes downhill from there. So what kind of soft tissue injuries can you have? I mean, of course, there are muscle injuries that you can get. You can tear a muscle. A lot of times those heal pretty well just by resting and letting them rebuild, but not always. Sometimes it can be a really bad muscle tear. And then there's tendons, there are ligaments, there's cartilage. Usually they will only show up on the standard tests that doctors do if they're incredibly severe. Labral tears will show up. Most of the time doctors will only say, oh, I maybe see a little bit of arthritis in there, but somebody might have massive labral issues going on. How do you figure out things when most of the doctors do the incorrect diagnostics for your body, aren't willing to pay for the diagnostics that would actually show the problems in your body, and they're missing these injuries? Well, there are a few options, I guess. One is to try some different cheaper methods of trying to figure out if you have injuries in different places. Talk about this a little bit in the group, is that there are different types of examinations that can be done in order to check and see if you might have instability or soft tissue injuries in different areas. So like we're kind of talking about, it's really the soft tissue injuries that we're most concerned with. And it basically, if you're showing any type of soft tissue injury on any of the scans, those are the things that you should really worry about. If they're showing up lightly on an x-ray or lightly on a CAT scan, then really that's a good time to push to get a little bit more diagnostic testing, because it won't hurt you to get that treated, for one, because there's something wrong there, and it won't hurt you to have somebody look into it further. There are ways that they can test like your motion and things like that to see if you have instability. A very good PT, for example, or OT, and then different prolotherapy doctors can check about how your joints are moving, and they can see if there is instability in how you're walking. They can see if joints are shifting around or moving in the wrong ways. Hypermobility is one of those things that when people don't understand it, it can be difficult to detect. People with Ehlers-Danlos syndrome can do this, and you're not supposed to be able to do that. Our hips move in really weird ways that they're not supposed to move, and then you hear the popping, maybe, or maybe you don't. Once you're developing those kinds of symptoms, you're pretty much at great risk for injury and for deterioration of the joint, and you don't want that to happen. And once you start developing pain, that's your nerves telling your body that you're having problems. And then the second thing that a lot of prolotherapy doctors do are palpations, and they do palpations all around areas. And really, a good prolotherapy doctor should be doing comprehensive palpations. And those help send signals to your brain to tell you if there is an area of injury that you might not be cued into, and that you might not be able to cue into because you're in so much pain in another area that your brain's overriding it. But when they press, for example, on the pubic symphysis, like in this area down here, that helps your brain cue into, oh, that does actually hurt when you press on it. Those kinds of examinations can really help give them a better idea. Now, none of these are perfect by any means, but if you're having tenderness in areas, then they're really areas, usually we don't realize that normal people don't have tenderness in those areas. Diagnostic injections are another route to go. Run away from people who are doing steroid diagnostic injections. Like I've heard a few people mention those. Steroids really tend to deteriorate the soft tissues, and there's not really a good reason to do those. There are diagnostic injections using numbing agents if you can tolerate those. And if you use numbing agents and the pain goes away, that can tell you that that's an area of injury. Now, those are usually only good for people who don't have a full body condition like Ehlers-Danlos syndrome or joint hypermobility. They're better for people who have maybe more a localized injury, like maybe have more just like SI joint or having discogenic pain, stuff like that. It can be detective. Diagnostic injections tend not to work so well in Ehlers-Danlos because we have pain all over, and you hit lidocaine toxicity or ropivacaine. There's only so much of that we can tolerate, and they could do 1,000 injections on us and we'd still have pain somewhere. So actually the palpations work a little better with us. If you're still not finding things, then you really need to start pushing for and appealing for better scans, ultrasound and high resolution MRIs, to really get into those areas. If they're telling you that you're not having a problem and you're still having pain and stuff like that, don't let them tell you that it's psychosomatic and that it's all in your head, because a lot of us, they're finding more and more and more that they're just missing those injuries. Comprehensive treatment. I'm finding far too often that doctors will far too easily throw around the term of what comprehensive treatment means. Comprehensive treatment, they'll say, oh, that just means I comprehensively treated your neck because I did a lot of injections in your neck. That's not what comprehensive treatment means. To kind of explain what comprehensive treatment means, I'm going to kind of explain it using the example of the pelvic ring, because the pelvic ring is a really complex area, and it's an area that, especially in women, and especially in women who have had babies, or women who have Ehlers-Danlos syndrome, or especially in women who have both, it's just this area where women will start having some kind of pelvic pain. And in that, I'll include hips, SI joints, pubic symphysis, pelvic floor, anything. I'm going to attach a little diagram because I think it's a diagram, but I want you to keep in mind it's only a partial diagram. So something I mentioned in another post the other day is that anything connected to anything that they suspect has an injury anything connected to that, and then anything below your injury could be affecting your ability to heal. As an example for that, I'm a person who's had a lot of treatments in my pelvic ring. For me to be able to fully heal and stabilize my pelvic ring, I'll say the one area that I haven't had problems with is my coccyx, lo and behold, but I probably just jinxed myself, and now I'll probably start having problems on my coccyx, we'll see. The pelvic ring, if you look at my body, I've had issues when I say anything connected and anything below. You look, I'm wearing a boot, right now. So if you can imagine, if I were able to walk right now, which I can't, this boot really throws off my gait because one of my hips is a little bit higher than the other. So that throws off my stability right there and my ability. So I'm going to grab this little cane here, help myself out while I'm standing and kind of showing this off. So that's one thing right there that can mess things up. My knees, I started having both of my knees buckled due to this. That's an issue. You've got your hips, both of your hips, that you can have problems, and that includes, the hips themselves, the cartilage, so your labral areas, you have to be careful with. You might hear people talking about the ischium, which is really important. You'll hear people talk about ischial tuberosity, like all of those kind of things. Your SI joints, of course, your pubic symphysis, your pelvic floor, that people can have problems with. There's really anything attached in your pelvis. And then when you turn around, of course, you have all of these other problems. You have your lumbar, your thoracolumbar, up here. You can start problems in here, your QL. So what is the point about bringing up all of this stuff? It probably sounds really overwhelming, right? Just named off a ton of things. And there are plenty of interconnected things that I didn't name. Muscles, ligaments, tendons, cartilage spaces that could be affected. And the point of this isn't that every single one of you is going to be affected by every single one of these things. The point is that any one of you has the capacity to be affected by any one of these things. And if you don't find a doctor who's willing to at least look at the interconnected areas that are affecting you, especially if you've tried a treatment or a few treatments and you're not getting better, then that doctor isn't doing their full job. And we found this particularly, I think, because of Ehlers-Danlos syndrome, because we have bad collagen, and so it means that all of our soft tissues are bad and have the propensity to go bad, that we've struggled the most with it, in that when the doctors weren't treating everything together, everything in tandem, all of the joints together, that we really didn't have the capacity to heal without the comprehensive treatment of all of those interconnected things. When they wouldn't treat my ankle, it cascaded upwards and caused my whole body to fall apart. When they only did injections in the back half of my body and not the front half of my body, the back half couldn't tighten up because the front half kept causing it to tear apart. And I won't even get started on what happened when, in my core, if they would treat one side of my body and not do bilateral treatments. And so this is not to say that all of you, or even every Ehlers-Danlos person, is going to be the same way that I am. But this is just to give you some awareness surrounding some of the issues that can come up and what the idea of comprehensive treatment means. Comprehensive treatment means considering the person holistically as a system and not as we found on an MRI this one spot, and so that's the place where we're going to give the injection. That's definitely not comprehensive. Or even, we found this in the lumbar area, so we're just going to treat the lumbar area. Again, that's not comprehensive. For some people it might be good enough, but for a lot of people, those kind of things aren't going to be good enough if they're having surrounding soft tissues that are really thrown off. So you want somebody who takes that all into account. So, once you have that diagnostics done and you find out where everything has gone wrong and all of that, then you have to get somebody who can really comprehensively treat you, and then choose what is the best treatment course for you. A lot of that, honestly, it comes down to money for a lot of people on the one hand, but then there's the issue of what's realistic. So we've had the discussion of prolotherapy is definitely not the strongest, but it's definitely the most affordable option. And then if you're going to get a huge area done, like the full pelvic circle, even though platelet-rich plasma or stem cell might be a stronger treatment, stem cell is usually activated by platelet-rich plasma. So they have to take your stem cells out, and they have to take vials of your blood out to spin the platelet-rich plasma. There's only so much blood you have in your body. So if you're having platelet-rich plasma, I find really there's only a limited number of joints that can be done at a time with it. So if you're looking at having, in the case that I've often had done, I've sometimes had 50 joints done at once because I needed to have that many done, sometimes more. It's not realistic for me to get platelet-rich plasma at 50 joints. There's not enough blood in the human body. Even if they drained me, I don't think they could get enough vials of blood. And so since it's using your own blood, PRP just isn't viable when you're having that kind of serious treatment. Now, if you have if you find some targeted, really severe injuries that are showing up, like, mentioned in some post-labral tears, or, like me, my big bad ankle here, I have had PRP here because, like I said, it's been destroyed, there's no cartilage there, and PRP worked where prolotherapy did not. And I hope someday to also have stem cell on it. And so you really have to weigh the costs and benefits of what you can afford. Sometimes platelet-rich plasma ends up, if you only have a small area that needs to be treated, platelet-rich plasma or stem cell or some of those other treatments end up being more affordable in the long run than having 15 prolotherapy treatments, if that makes sense. And 2 platelet-rich plasma treatments might have healed it. So you really have to look at, how severe is the injury, how big is the area that I'm having done, how many treatments do I need, all of those factors. And then, like I said, money ends up being a big factor. Final thing is aftercare, and really how do you end up healing. There's been a huge debate about to brace or not to brace. Personally, I brace early on because my joints are really unstable, but not all the time. I brace during times when I think that I'm at great risk of injury. So there are a couple of doctors, like my PRP doctor, I have to travel to him a really long distance, and they ended up on the way back, since I got a ride somewhere, they ended up going 2 hours out of the way. If I had not braced for that, and they were on back roads and they were really bumpy, I would have probably undone a great amount of my PRP. And we've had some patients in our group too who have said that they regretted not bracing because of travel, because they've had accidents happen, falling, jarring, bumpy rides, things like that. And so personally, my preference, I'm reticent of doctors who have traveling patients who don't tell them to at least brace for the travel, because there are so many unpredictable things that can happen. Car accidents when you're traveling, minor fender benders that don't affect a normal person can set a person back an entire treatment. There are things that you just don't have control over. I live in the north, and so that may also be why I really am a fan of bracing. I can't tell you how many times I've slipped on the ice when I've been out on either my cane or my crutches or stuff like that. Times when I really thought there was no chance I was going to fall. Slipped on the ice, lost 5 treatments worth of progress. I don't think it's worth it to do it, So like for me, some people say that, their SI belts don't really help that much. So I had this handy dandy little lumbar brace that I really like. It provides an awful lot of support, some pretty tight support. Of course, that style one, pretty easy to put on. And, gives me a lot of support when I'm getting around. I don't wear it to bed. I don't wear it around the house because I don't tend to fall when I'm in here. And of course you can't control everything. Accidents will happen. But I think that there are times when you know that you're at risk. And so those are just my 2 cents. We put out tons of suggestions about your health, diet, stuff like that. I think anything you can do to help your treatment go better, I recommend doing it. So that's my intro to Prolo. Hope it's helpful. And I wish you all well. Thank you. So, final thoughts and comments. Of course, this is just a video for educational purposes. This should not supplant the advice of a doctor. Regenerative medicine is just one of your many options. And there are also many other types of regenerative medicine that you can choose from. We only discussed some of the most commonly used and commonly researched in this video, but there are lots of others, and we discuss all of those in our group. There's also several other options that you can choose to support your healing, and we discuss those as well. So, all of the good stuff, feel free to click to join. I think that's down there somewhere, not on my body, but on the YouTube. And feel free to join one of our groups. They're on Facebook. This is the 21st century. Hopefully a lot of you are on it. They are closed groups because we like to be able to keep the discussions confidential so that people can feel free to talk about their experiences. We have a group for patients that is a regenerative medicine support group that will be in the comments below. There is a regenerative medicine research and information group that is for professionals, and patients are allowed to join if they're particularly geeky, which I happen to be, and also researchers, which I also happen to be. And then we have plenty of medical professionals in it, different kinds of medical professionals. I think that we have representation both from around the world and from just about every type of profession, from medicine to dentistry to veterinary practice to, I don't know what else does prolotherapy. Someone help me out. Anyway, they're all in there. So please feel free to join any of those. And then as an aside, if you happen to have Ehlers-Danlos syndrome, which is becoming much more commonly diagnosed, I think they're starting to realize that it's not a rare disorder anymore. I also run a support group for Ehlers-Danlos syndrome, and that will be in the link below as well. It is a very different kind of Ehlers-Danlos syndrome support group. There are some really great professionals in there. And I think one of the very noteworthy things in it is that we allow people to swear. So I look forward to seeing you all there. All right, thank you. Have a great day.